We're good? Okay, thanks. So I would like to welcome everyone here this morning. This is a public service briefing for the Parry Sound area on the coronavirus or COVID-19. This briefing will be live streamed with recording available on the town's website and YouTube channel. We also have Kojiko Cable here, and we have Tom Mangos in his media group. We have the Moose FM here, and we have the North Star as well. The layout for today for the actual event will be I will make some opening remarks, and then I'm going to invite up Dr. Jim Scirocco, who's our Medical Officer of Health for Parry Sound North Bay, and he will take everyone through what the health unit and their role in this, which is the lead agency on this particular in an event like this. And then after Jim has done his presentation, then we'll have members of the health center come up and let everyone know what is going on within the health center itself and the role that they're playing within this event as well. So as far as the town of Parry Sound goes, we've been monitoring the COVID-19 situation since January. Internally, our focus has to ensure health and safety in the workplace and the public who certainly use our facilities. All of our actions are guided by public health experts. Actions taken to date include additional hand sanitizers have been made available, and we are installing dispensers in municipal facilities that don't already have them. Posters have been put up to remind staff and members of the public to practice good health and hand hygiene and hand washing to prevent the spread of the virus. Staff have also been advised to practice social distancing. We have instructed the cleaning staff to use appropriate disinfectant when cleaning municipal facilities, particularly the public spaces, and we are developing material including self-assessment information for staff that they can refer to when returning to work after traveling. Internally, we are meeting twice a week to monitor the situation, to take actions as required, and town staff are taking a lead in coordinating with area municipalities to support the health unit. And there are members in the audience today from a number of surrounding municipalities and other organizations as well that are here to be part of the event. So I will now turn the microphone over to our Medical Officer of Health, Dr. Jim Scirocco.
Yeah, there you go. Good morning. I'd like to start off by thanking the town of Parry Sound and Mayor McGarvey for hosting this today. And start off by saying that it really is understandable that there are many concerns and fears around COVID-19 across the region, across the country, across the world. And it's normal to feel that way, especially when we're not sure what will happen. There's uncertainty. And it's important to remember that the risk to our community still remains low. The risk in Canada remains low. It is anticipated that it will end up circulating in the community, as it already is in many. And it's very sad that there will be deaths associated with it. So far, there's been one death in Canada. Fortunately, there are ways to help keep you and your loved ones healthy. Be informed, be prepared, be protected. This pandemic is ongoing. It changes rapidly. So it is important to stay informed, as recommendations may change. The Health Unit's website, www.myhealthunit.ca, provides trusted information and lists other reliable sources to help answer questions you may have. And it is also important to be informed about your personal risks and your families, and we can help you with that. Being prepared for emergencies is a good idea all of the time. Power outages, extreme weathers, those are examples of that. And it's a good idea to ask yourself, what would you need and your family need if you had to stay home for a couple of weeks? And again, the health unit has detailed information on our website to assist you with that. You can help protect yourself and the people around you by following simple hygiene practices such as washing your hands regularly, using alcohol-based sanitizers, not touching your face, covering your cough and sneeze, and staying home when you're sick. It is not recommended that individuals use masks to prevent COVID-19, as moisture can build up in them and they'd be really ineffective. If you develop a fever, cough, and or have difficulty breathing, and within 14 days of travel to an impacted area, had close contact with a confirmed or probable case of COVID-19, or close contact with a person with acute respiratory illness who has been to an impacted area, call the health unit or your healthcare provider. This will help keep the emergency room resources available for trauma and emergent care patients. If you do not need immediate medical attention, or if you do need immediate medical attention and you have severe, for instance, severe difficulty breathing, then you need to call 911, obviously. And mention your travel history if possible, and let them know what the situation is. People of all ages can be affected by COVID-19. However, older people with pre-existing medical conditions such as asthma, diabetes, and heart disease are much more likely to become severely ill. As a precaution, the health unit has asked all long-term care homes in our district to restrict visitor access to compassionate care only. The health unit also recommends that individuals monitor their own health before visiting older family members and do not visit if you are feeling unwell. When thinking about your March break travel, full stop, do not go on a cruise. For other travel, consider these factors: your destination, the number and severity of the cases, potential travel restrictions that might be in place. You also want to look at your own access to medical care and your own personal health conditions that might impact your decision on whether you go. I recommend that people visit the Public Health Agency of Canada's website for up-to-date travel advisories that might be in place. And also you can give the health unit's travel clinic a call if you need advice. It's important that you reassess daily to see what the situation might be. Ontario has closed all publicly funded schools for the 2 weeks following March break. If your child is not exhibiting symptoms, they do not need to be tested, and they do not need to be separated from others. We recommend that employers speak to their employees about options for sick days, when possible, to work from home if they are feeling unwell. You should not be going to work sick, just as I'm sure you would not want your coworkers to come to work sick. We also encourage employers to review the World Health Organization guide for getting your workplace ready for COVID, which we have linked to at our health unit website. Overall, we want to stress the responsible use of the emergency department. Again, testing isn't always necessary. There are no specific treatments for COVID-19, and there is no vaccine that protects against coronaviruses. Most people with COVID-19 will recover on their own. 4 out of 5 have either no symptoms or very mild symptoms. So you should just really monitor yourself and call your health care provider or the health unit and follow their instructions. Likely, you will be advised to stay home, separate yourself from others if you're symptomatic, limit your contact with other people, drink plenty of fluids, get rest and sleep as much as possible, try a humidifier or hot shower to help with a sore throat or cough. There are a lot of similarities with what we would do with the flu at present. This isn't the flu, but there's a lot of procedures and processes in place that can help you. Most people will be better in 1 to 2 weeks, similar to the flu. That's what we're seeing throughout Canada right now. Could it change? Absolutely. That's why you need to keep informed. And if you do need medical attention, it is there. They are preparing for this. And if you need to call 911 because of breathing difficulties, it's there too. And there will be people looking after you. So really, the summary of all of this is to be informed, be prepared, be protected. Thank you.
Thanks, Jim. We'll have Donald Sanderson from the West Prairie Sound Health Center, and then Donald can introduce any of the other speakers that he has from his crew from the center. Welcome.
Thank you, Mr. Mayor. My name is Donald Sanderson. I'm privileged to be the Chief Executive Officer of the West Prairie Sound Health Center and Lakeland Long-Term Care. We, making sure that our community, our staff, our patients and families are safe is always job number one, and we're prepared to deliver on that. We have, as of yesterday morning at 800 hours, implemented our incident command structure, and we are in real-time communication with our team and then meeting regularly throughout the day and formally at least once a day. I should introduce the other members of my team. Jim Hanna, who's the executive lead in charge of communication. Katie Hogue is our director of primary care, and Katie has been seconded to our COVID-19 response. And Dr. Will Smith is our lead anesthetist. He's the president of our medical staff and our acting chief of staff in Dr. Farger's absence. So I would ask Jim to say a few words in terms of our corporate response and readiness.
Thank you. And we would also like to thank the town of Parry Sound and our partners at Public Health for this opportunity to be here, and to the media for being here. You are our partners in any crisis situation because you are a conduit to the public to bring important safety messages. So thank you for being here. Donald mentioned our incident command structure. We have an incredible amount of brain power in our organization. It's a standing room only meeting of leadership from every department, from clinical, housekeeping, supply chain. Our partners are in that meeting, both of our long-term care homes, our family health team, EMS, ACS, our nurse practitioner-led clinics. Dave Thompson has been attending those meetings as the person responsible for emergency response planning and our link to municipalities. So we are preparing. Lots of planning work is being done. Important messages for the public right now, and Dr. Chirico mentioned this, is judicious use of our emergency room services, that if you are really sick and you need our care, please never hesitate to come to Emerge or call 911 if you need care. But if you can look after yourself, if it's a mild type of illness, stay home and stay safe. The other important message, starting this morning, West Prairie Sound Health Center is screening all visitors to West Prairie Sound Health Center. All entry to the health center for visitors and members of the public are restricted to our front entrance, and of course patients coming in our Emerge door. If you are accompanying a patient to our Emerge, we really require those people accompanying a patient to go through screening. Dr. Smith has one, I have one. We went through, and Katie has one. We went through screening this morning and we're given a sticker. So when we're in the health center, it's clear that we've been screened. And so any visitor to the public, from the public, will have to go through that process. People coming for an appointment, come a little bit early because you have to go through screening and then you still have to register as the normal process. But this is a key step in keeping our patients and staff and physicians safe. But it will be certainly an impact on our public, on our visitors. It's an unusual step, but it's a step that we're taking. Thank you.
So thank you for having us. As Jim had mentioned, we have a single entrance currently for staff and patients that are entering the building. Next week, we're going to move that to phase 2, where we'll also have a separate entrance for staff to keep our staff even more healthy and safe away from people that might be getting screened and screened positive. People who have traveled and who are sick with symptoms we are required to report that to public health, so we do have that mechanism in place as well. We also have that mechanism in place at all of our nurse practitioner-led clinics, and we are sharing resources and screening tools as well so that other people can be prepared as well in the community. Thank you.
Sure, thank you for having us. I don't have a lot of words prepared, but I would say, you know, our incident command structure was activated yesterday morning. However, this is something that the members of the medical staff have been planning for over a course of several weeks. This is something that we think about a lot, we discuss a lot, we lose sleep a lot about it. I just want to let you know that this, for us, is an all-hands-on-deck scenario. We have learned the lessons from other jurisdictions, and we understand that one of the difficulties is going to be that resources will not always match the need. And we're working hard now to fine-tune our workflows and our processes so that we use our resources as wisely as we can. The message has already been given by Jim and by the rest of the team that you know, this is not a process that has any specific treatment. There's no cure right now, and coming to the emergency department if your symptoms are mild will actually not be helpful for you, and probably will not be helpful for the rest of the team. We really need to reserve the resources that are in the health center and the emergency department for more severe symptomatic cases. There's a very limited number of tests that we have available for us to use, and those will be used on the cases that are most severe. So, you know, if you are experiencing only mild symptoms, you will probably not get tested, and the instruction, the same as has been already given out, is that you will probably be asked to be in self-separation or isolation at home until such time as your symptoms are fully resolved or 14 days past your exposure has elapsed. We are already asking our medical staff to reconsider all travel plans. I have a number of physicians on the team who have already canceled their travel plans, and we are planning ahead. We know that the human resources aspect of this will be huge for us, in addition to the resources, and we would ask everybody's understanding in our efforts to try and limit the number of people that do come to the hospital and to the emergency department to the people who really need it. And that doesn't mean that that business as usual doesn't continue. We will still see heart attacks, strokes, all the other things that we would see in the emergency department. What we would ask is that if this is mild symptoms for COVID related type issues, that you try to hold yourself back from coming to the emergency department. Reach out by telephone to the health unit or to your primary care provider. And that it will be a big step in and of itself in helping us deal with this as it evolves.
Yeah, you go right ahead.
I just wanted to further emphasize that I've noticed, not being from Parry Sound, but I've really noticed that we've been working together for a number of years, and that the community is really close-knit. And I noticed that, too, that you really do care about each other, which is amazing, and that you can come together in times like this, that you can work together. It's not a matter of pointing fingers at people. You will come together to work towards cooperating, and when the hospital is reaching out to you saying, don't come to emerge, only if you're really sick, I know that people will step forward. We're looking at other preparedness planning, and we will be engaging with the community because we're going to need the community to come along with us. This situation changes every day, and so we are planning for the future. I also want to congratulate the hospital and the staff, because we've worked with them, all the way along. That's what we do every month. They've got their infection prevention and control. They've been practicing it. They live it. It's part of what they do normally, and they do it really, really well. And you see the commitment from all staff to make something like this work. They've got continuity of operation plans. They've got pandemic planning. They've got disaster planning. All of these things people don't know about, but from my perspective, when I see it, they're to be congratulated for, being prepared. And now is the time that this is business that they've practiced, and they to reassure the public that these things are being done. And I just wanted to say it's been a privilege working with you, and I see the work and the effort that goes into it, and everybody's committed to keeping the community healthy. So just wanted to say that.
Thank you. Yeah, it's teamwork, and that's what we've usually been about. As I've said many times, I've been very proud about this community in the area and how they pull together in times of need, to make sure it's support so people have food on the table, if that's the case. Or in this particular case, it's protect the community to make sure that we have, it doesn't get out of control, and we're involved. I just wanted to update everyone on a sort of a broader provincial perspective. As president of the Association of Municipalities of Ontario, I was in Toronto yesterday, and we had an update from the Deputy Minister of Health with regard to the situation in Ontario and how that's going. And for those people out there, whether it's you're in a municipality, you can go to the AMO website, and the AMO website will direct you to other information as well with regard to public health and what the province is doing with regard to that. So don't be afraid to reach out, find out more, and we really appreciate that. So at this particular time, I'd also like to recognize our CAO, Clayton Harris, and our Director of Emergency Services, Dave Thompson. And so we'll open this up to the media to ask questions of anyone here. There is a microphone at the desk there, and we'll just make sure that it's on. And then you can direct your question to whoever you want. And so this is all about getting that information out to the public, which is extremely important. So if you got a question, ask it. Oh, click the button.
Hi, folks. James Bowler with Your TV, and I'm the host of Cogeco News. I have a question about screening for coronavirus. In Muskoka, they're setting up 2 different sites that are off sites from the hospital to ease tension on the emergency rooms. Is that something that's going to be happening in Parry Sound?
Thank you for the question. So part of what we're doing with that big team of people, including Dave Thompson from the town, is planning to do that. There's a process we have to go through. So we have just this morning completed our plan. It's been signed by the CEO. It now needs to be signed by an infection prevention control person from inside our organization. Then it goes to public health, and it goes to Health Ontario North. So we've done our work. It is now being distributed. If our plan is approved, then we could roll out a center like that.
How soon do you think that would be, and where would be a possible location in Parry Sound?
We're looking at a number of locations. We haven't really decided on one. It is important that they be kept away from our emergency department. Katie's been really involved in that planning. Dave's been really involved in that planning. I think we have the human resources to launch it really quickly. It would be, how quickly could we launch the supplies, the personal protective equipment we would need, the test kits, etc. We could do it. I couldn't give you a number of days or hours, but we can do it quickly if our plan is approved.
Okay. And just a sort of follow-up question to you guys, and it's not to do with that. You were mentioning, if you have mild symptoms, you should probably just self-isolate. But there are a lot of people who have jobs, and they may need, doctor's notes, things like that. They may not have doctors to go to. Is that a case where they could come into the emergency room and get that type of, paperwork that they need in order to get off work?
I think that we have to look at this situation differently than we normally would have for work. And that's why it's really important to reach out to employers to understand the complexities of something like that and the impact that would have on the healthcare system. And so we're recommending that from a public health perspective, although certainly haven't gotten sort of provincial approval, but in our district, I would like to recommend that you don't have to have a script from the doctor to say you can go back to work. I think that that really puts undue stress on a resource that needs to be focused on what is important right now, and it's dealing with sick patients.
So just to clarify, that's not an official statement right
It's not
now.
official, but if I were in charge, as far as in our district, which from public health I am, I would strongly recommend. I mean, I don't have you know, the legislative authority to say you can't have, you have to have that, but I do think that people really need to be flexible in these situations, and that's my recommendation. Don't have them.
If I could add to that, as one of West Perry Sound's largest employer, we would concur and support Dr. Chirco's recommendation.
Thank you.
Good morning, Tom Mangos from Radio Works Perry Sound. Is there a future protocol being set up for things like committee meetings? Specifically, Perry Sound has got a council meeting coming up next week and a budget meeting coming up next week. Do you encourage people to still attend the open meetings of councils or local community meetings?
From our standpoint, they can always, if, you know, our budget, I believe, is online right now, so people can go through it if they have questions. They can email those questions in and provide them to staff, so staff can relay them to council. Our meetings will be live streamed, so they don't have to come in to the meeting. We will have council members here, so we're going to keep it tight if they want. If someone wants to come in, that will be up to them, and we've got the appropriate hand sanitizers around so that to make sure that they're, you know, their hands are clean and that sort of thing to protect themselves and the rest of us as well. But do they have to? No, they don't. There's lots of avenues that we provide that the public is able to access council and information. And as this is being live streamed today, those meetings will also be live streamed so that they can watch what's going on.
So as yet, there are no plans for restricting access, let's say, to the actual council chambers if somebody does want to attend?
No, not yet.
Jamie, can I?
Yeah, go ahead.
You raised a really interesting point, and it's very important. And I think that the message that we're trying to get through is that this is an evolving situation. It changes, and it may change daily. So what we are doing today may not be what we're doing tomorrow. And it's all based on what the evidence is showing us. And we really need to go by the numbers and the scientific evidence that presents as to, and we're monitoring it daily. And it can change hourly. So what I'm saying is that you may see more social distancing. You're already seeing it across Canada in different areas, where now they're coming out and saying no mass gatherings greater than 250 people. You know, so they're canceling lots of venues, sports venues, conferences. People are saying, you know, don't, as Will was saying, you know, want to keep the staff here, recommending, you know, we're going to need you, and if you can stay or alter travel plans. So it's going to be a changing situation, and you may think, oh, just yesterday they said, well, you know, you could come to the council. Well, maybe we might get to a point where they won't be able to, and so we're trying to keep people informed, and those kind of social distancing things that you're talking about may increase for sure. Now, if we found that, well, it already peaked and came down, then maybe we wouldn't have to do that or get to the point. We also have to be aware that people can pass the virus along with mild symptoms or no symptoms at all, which means that it's likely the tip of the iceberg, the ones that are positive. There are people around that have it in the community. The transmission, where we can say that there is transmission in communities. Is it here? Don't know for sure yet. But what we can say is that there's 0 cases in Canada, the risk remains low. We're using this sort of, what we say, the distancing measures. We're using control measures put in place to try to help. We won't stop it, but we can delay it. Delay it till we can get a vaccine, and that's going to take probably a year or a little longer before you can get it into people's arms. But that's important to delay it as, I mean, people are commending China for the tremendous work that they did to contain as best they could. They couldn't stop it, but they contained it enough that they were able to delay it from spreading, and it probably saved thousands of lives. But you also have to see what's happening. They're coming down, and we're just starting to go up. And that's why I say we expect more cases, and unfortunately, more deaths. But I think you have to put it into perspective. When you look in Canada, we have hundreds of thousands of cases of the flu every year. Even some people might estimate low millions. And we have 3,500 deaths. We've had one death across Canada, as regrettable and sad as that is. But we need to keep, I think it might help allay some fears. People sometimes don't even think about it. And yet, we know that the flu is still more of a risk to these elderly patients. We've had recent deaths in North Bay in long-term care homes because of the flu, not COVID-19. So we're trying to protect them as best we can. So it's a changing environment, but we need to keep it into proper perspective.
Thank you.
Let's wipe it down.
Okay, so we have heard a lot from the hospital, we've heard a lot from public health, and we know that the municipalities, of course, are preparing and doing everything they can to keep the governments running. We haven't heard from emergency services yet with the fire services. Are you guys all prepared with all your mutual aid to come in?
So a emergency such as this is a human health emergency, and the leads for an emergency such as this is, of course, our health agencies. The municipalities in West Prairie Sound are attempting to align ourselves, and we're going to provide support to the health agencies, the public health unit, as well as in West Prairie Sound, the West Prairie Sound Health Center, to help them do their jobs properly. So we can do that through communications. We can do that for providing support to the health center in moving forward with assessment centers or issues of that nature. The other important aspect that the municipalities need to take into consideration is our critical infrastructure. There are services that the municipalities provide that it's absolutely critical we continue to provide. In the town of Parry Sound, there are things like the water, wastewater systems. For all the municipalities, fire services are important, as well as some of the financial services. So we plan towards making sure that we can maintain those services. We also have to consider that we'll probably lack resources, human resources, and that we need to manage that when that occurs. And in the case of fire services, it's very important that we don't lose so many of our volunteer firefighters at any given time that we can't function properly. So we're working together to support each other in case some of our firefighters become ill and any one municipality does not have enough resources to be able to service its municipalities. We'll be there to support each other in those circumstances. And the same thing will occur through the other municipal departments. Both McDougall and Parry Sound have water systems. We can share some of those resources if they become low. Those are the types of issues that we're planning towards and how we're going to deal with them as the situation evolves.
So after we had H1N1 here a few years back, and we had similar conversations like we're having now, we saw a whole bunch of bylaws and plannings and resolutions go through the public sector looking at the next time, putting all these systems in place. And that is what we're seeing today, is those systems being implemented for the public health and good and continuing our communities. Is that fair? So all that work that you guys did before when we were reporting on it, it was a little dry. That's why we did this.
If I may,
Yes.
yes, that's a really good point, and that what I've been very impressed with is the cooperation from public health perspective. When we knew this was coming, and we work with Dave, and they've done a fantastic job to get things coordinated, and we're working to prepare for it. When I mentioned about the flu, and I mentioned that there is some similarities. Coronavirus is not the flu for sure, but what we're seeing with the evidence is that there is a similar kind of pattern. However, could in Italy happen here? And that's the question that people are most worried about. And it's possible. The evidence is not showing that it's here, that we're going to experience that, but we're preparing for that kind of scenario. And all the work that has been done and the learnings that we've had are being put into place now. And that's why I certainly commend Dave and all the work that you're doing locally to get things in place and working with the hospital to support that kind of an effort. And it's being done.
Perfect. Now, oh, did Peter leave? I was gonna put him on the stand too, because we're not seeing from our, we haven't heard from our doctors. Yes.
I can just speak to that just
Okay.
from a resource sharing perspective. So I have the privilege of working very closely with Peter as the executive director of the family health team. Of course, the nurse practitioner-led clinics also have very similar patients. We see the same patients. So we've shared the same screening tool. We are screening our patients the same. We are giving the same message to patients and visitors. All patients and visitors will be screened just as they are at the health center. So we're, again, giving that very same message with the same resources. If anything changes, it's a back and forth conversation. And so we've all worked really well together. As everybody sort of highlighted, it's a community support, it's a community program.
That as well as that we're collaborating very closely with Belvedere Heights and Lakeland Long-Term Care, our partner agencies, as well as the Perry Sound Family Health Team. So we're working together, we're sharing messages and strategies, so we're creating that very important synergy.
We did see yesterday, after the schools were closed, the publicly funded schools were closed by the province. There did seem to be a bit of a push on the grocery stores in our town and our community. It seems to be subsided. I was saying earlier that it looks like the liquor store is the more busy one today. But having said that, there's people in our community who are at risk. We have a older population than the rest of the province statistically. We have a fair number of people in our community who are below the poverty line, who rely on the food bank. So what considerations are being made to help those more vulnerable people who aren't jumping in the car at the end of the workday and going to the grocery store?
I'm not sure that I can give a full answer. I think both of us are going to give a full answer. But one thing I would like to, identify for everyone is that community is about helping each other. And it's incredibly important that in times of need or in times such as these where there's dangers or issues, that we look out for each other. And I would really like to encourage everyone to check in on their neighbors. If you haven't seen your neighbor for a day, to just give them a call. You know who they are. We all know who our neighbors are. And part of being a good community member is putting yourself out there and going the extra mile, especially in times like this, and attempting to make sure everyone else is well and safe. So if this progresses, there will be people, and I'm sure there will be people, and there might already be people who are either self-quarantining or will be required to quarantine for 14 days. Finding out what those people need, if they're your neighbors or your friends or whatever, and putting that on their front step so they can have that, so they can stay in their homes and do their part, which is staying isolated, so they can do their part and stay isolated, is incredibly important to the overall response to what we're going to deal with. And that's across the entire country. But that's what a single individual can do in their community, is they can focus on those sorts of issues and do their best to help out and look out for each other.
Okay.
I think as Dr. Shiroko said, this is an evolution of how this is unfolding. So I think as that goes, what Chief Thompson has said is right. We as a community come together. We try to look after each other. Be a neighbor. If you're not feeling well, as he said, reach out to your neighbor to say, look, I'm not feeling well. I'm sort of gone into self-isolation. So we move from there. With regard to the food banks, I think we'll need to reach out to them to make sure that those people that maybe cannot make it to the food bank, that there's a system in place where maybe a delivery can be made to those individuals to make sure that they have food on their table. But again, it's an identification thing. We need to know who those people are. We need to know what their situation is and move forward with that. But certainly Harvest Share and the Salvation Army, who are two major food banks in our particular area, we need to, I think, have a conversation, if we haven't already, with them to see where they are and if they have protocols in place as well. So it's a really good question. And again, it's one of those ones where, you know, I mean, we try to do as much thinking and as, you know, Donald Sanderson said, the brain power that's in the hospital and that sort of thing and in the community that's trying to make sure that everyone is safe, you know, that we add those things to that list to make sure that we are covering that off. So good question, and you know, it's something that we will definitely work with.
I only have a couple more, and then I promise I'll stop. It's such a good opportunity, though, with all you folks right here at one time. So the schools have been closed for 2 weeks post-March break. McKellar has canceled all social gatherings and direct contact with their municipal staff for the same time period, so March break 2 weeks prior. But then at the same time, I just see on my social media feed that the Parry Sound Public Library is keeping its March breaks. I haven't heard anything about Seagoing canceling it. What kind of signals does this give the public, and what should they be thinking of, or how could they react, or what's rational to take from hearing, you know, like McKellar's canceling social gatherings and the schools are closed? I mean, that seems to be what set off that panic last night.
Excellent question, because it can give you mixed messages when people see this, and it really depends on how you want to view it. You can take the stance that when you see a lot of these things happening, when you look at that, oh, they're closing down, this is really serious. Are we taking this serious? Absolutely, we're taking this serious. And why are we doing that? Because we need to protect the most vulnerable. And there is the unknown. We don't know if this is going to be something that's going to just gradually occur, or is it going to be a little bit quicker than that? And we don't know the true severity. So it makes perfect sense. So you can look at it and be frightened, which I don't believe. I'm not frightened. I'm being prepared. So we're saying the same thing to the public. We want you to be prepared. And so these are some of the steps that are being taken. So I look at it as a positive thing. When these steps are being implemented, it's all to bring awareness to what's going on so people can be informed, so they can then actually be prepared. And so I see these measures as being helpful for the public to say, okay, well, it's coming. And again, we look at the numbers. We look at what's occurring right now. 0 cases in our community, and we also have a low risk right now. And it could change, absolutely. And I don't mean to downplay when I talk about comparisons to the flu, but we need to understand that that's where we are right now. It isn't, the flu is still more risky to the vulnerable. And yes, we are taking the situation quite seriously, and that really helps, I think, when people just look at what, people need to be empowered to be able to say, well, what can I do? I know what everybody else is doing, but what can I do? Because they need to feel that they're in control, and they are. And there's things that they can do, as I mentioned, to help that. So I think this social distancing, they should be looking at it and saying, yeah, they're trying to keep us safe. And let's do that until, you know, and whatever the next step will be, we'll deal with it.
All of us in this room, I'm pretty sure we're in our jobs or pretty close to our jobs in 2003 when we had SARS, in 2008 or whenever we had H1N1, and then of course the financial crisis. What message can we give to people, keeping those two past pandemics in mind, that we can give people to remind them that we've been here, we've had this before, and that we're moving forward?
I can
Sure.
Get the medical perspective, or if you'd like to.
I'll just start by saying, I guess to begin with, common sense.
Okay.
You know, you have the power within your own person, okay, to make sure that you're keeping everyone else safe as well. It shouldn't be that you're relying on other people to make sure that you're not doing something at times. Sometimes you have to take charge of your own self and say, I'm not feeling well. I'm not going to go into the public. I'm going to keep my social distance to make sure that I'm not infecting other people with no matter what it is that you happen to have. So you have that ability within your own self to be able to do that. And I think moving forward, we need to recognize that. And then the rest of it falls into place with all these teams and the efforts that have been put together by the whole community and public health and the hospital and emergency services to make sure that on the broader scope that we are looking at that. But an individual themselves has the ability to use that common sense, hopefully, to say, I'm not going to put other people at risk. And I think moving forward, I hope more people take a look at that. So,
That's a really good question. I'm glad that you brought that up because the past pandemics have been really, really important, and there's some important things that we can learn from that, and we have. But the main message I'd like to get through is that we got to the other side of them. We worked through them. Yes, people died, and as sad and regrettable, but we've learned from why that happened, and things have been put in place to help prepare for that. I'll give you a perfect example. When SARS hit, there was not as much information known about it at the time. Tests didn't come available for that for months. Within 2 weeks of the information coming from China about the sequencing of the virus, they were able to develop a test. And I mean, it might not seem very newsworthy. However, it's extremely newsworthy because they worked really hard. The technology has changed. They were able to put something in place that would have taken literally months. So that really helped with managing, certainly that. The other thing it really helped us to do is to look at what we need to do to prepare. And there were learnings from that as far as we need to know that we have a system in place to help protect healthcare workers. Healthcare workers are the one of, along with the vulnerable population, they were at the highest risk in SARS. So steps have been taken within their daily work to protect staff. So that's all in place too. So there were some really great learnings from that, and that's what is currently in place. We learned from another example in 2009 with H1N1. We put in place and worked with municipalities, the CEMCs, to get a system that we could open at that time, flu assessment centers that were for treatment and testing. And we had 5 throughout our district ready to go within 6 hours. Had the need arise, we didn't have to, but that forced a lot of relationships, and you're seeing it happen right now, where because of that, we have these things in place. So there were lots of benefits from that. But again, just to go back, we got to the other side, and we will get to the other side of this.
Okay, I ran out of my list, so you guys are off the hook.
Sir, I'd just like to say, it's a great question for people who have been around the community for a long time. So when the first thing we did, we went and found our H1N1 plan. We found that plan. We worked with the town to create that plan and other partners. Doing that, we found our SARS plan. If you look at Justice Campbell's interim report on SARS, there's a chapter about Parry Sound. We had significant experience there, right next door in what used to be the James Street site of the West Parry Sound Health Center. We still have people who were screeners, who organized that screening, who organized the personal protective rollout in our emerge. Those people still work with us, and that is the expertise that Katie and Dr. Smith and the rest of us are bringing to the table that still exists in our organization.
Awesome, thank you.
And a third of our community, approximately a third of our community, including my children, we were in quarantine or self-isolation at that time. It had a significant impact here. So it's not just healthcare workers and health organizations. There are lots of people in the community who understand what this means and what the impacts can be.
Howdy. I have some follow-up questions. Jamie, this is either for you or for your knowledgeable staff over here. Say we get to a scenario where we are in a quarantine situation. What measures does the town have ready in case, town hall shuts down, services shut down?
I will refer to our staff on that one, and our CAO Clayton Harris. They have been working on that.
Thank you. A lot of, as the mayor mentioned, we can continue perhaps council meetings. They're live streamed. I was checking with the staff today. There's a lot of methods that people need to pay bills or communicate. A lot of online ability in that sense. So we can close down or at least restrict access to the building and still carry on a lot of the provide the services that are required. The chief mentioned water and sewer treatment. Those facilities, we're meeting with staff to come up with contingency plans, make sure that we've got the proper people trained and in place, so we can look to assistance from McDougall and others, and there's even contract services available. So, you start with what's the most critical service. Obviously, water and water provision and sewage treatment are important, and then kind of scale back to what's least important, what services could we put on hold. I'm sure nobody is in a rush to get their tax bill, for example. So, what's critical, what's our backup plans, and it's kind of playing it by ear. Right now, we're not looking at closing any municipal facilities, but as the mayor mentioned at the beginning of this session, we take our lead from the experts. What's the province recommending, what's public health recommending, and we'll take those leads. To the extent that our facilities are open, we've taken the measures, and again, the mayor referred to them at the outset, to make the facility as healthy as possible for the staff that work here and the public that use it. So both in distancing, social distancing, individual hygiene, hand washing, there's a lot of extra sanitation available, and the cleaning staff going through the facilities with the proper sanitization so that when people do come to the town office, they can be assured that it's as clean as possible, so they can do the business that they need to do.
And I have a follow-up question to one of Sarah's many great questions for the health unit. There was some questions about social responsibility, and you do what you think is best. Are we at a situation now where maybe people should be considering canceling events?
Yes, I think so. You really have to look at the risk, and the Public Health Agency of Canada has come out about 2 days ago with a document on mass gatherings and what information you need to know about it, and to help inform people as to whether or not they should be canceling. And it's basically a risk assessment, and so it's not as simple as, yep, just cancel everything. Some things are more important that need to happen, and you wouldn't be canceling, because you need to have those planning activities. You need to have those kind of meetings. And sometimes, as much as technology is helpful and doing things distance and remote certainly is an option, but sometimes you have to be with people. They talk about the differences in the risk. Some are higher risk, depending on the venue. There's many factors involved. For instance, let's say you had a sports event that you're going to have a lot of people, and then you have to even look at access and egress, where are they all coming into the same area where people are going to be really close proximity. So those factors. Are you having a conference where you're having international travel, people having come in? Those right now I think are top of the list. No, we're not going to do that. You have to look at, okay, so who's coming to some of these conferences? For instance, is it going to be an older generation, the ones that may be more at risk? So, that's different than what if you've got scientific minds that are coming together to deal with COVID that needed to be there? So to say that you might say, well, they're being inconsistent, they're doing this over here, but they're not doing it. There's a lot of things that come into the decision making for that. And I think that you need to say, well, is this because we're in a real bad situation, they're not just telling us? No, that's not the case. I'll be honest, if things change, I will come out and say, yeah, the things have changed. There's higher risk involved here. We've had, so many deaths that have occurred. We've got more cases, and we're being overwhelmed and emerge. That's just the reality of what we have to deal with. But that's not the case right now, and we need to recognize that. So what I would say is that it's an effort to protect ourselves in the future. Are we at a stage where we're overwhelmed now, or that, my God, this is going to really cripple the city? No, not at all. So that's why we're doing it now, because it will help in the future to delay the spread.
I have one more question for you. And my intention of this question is not to cause any kind of fear mongering, but I think that in people's minds, we need to know the reality of this situation. And I did ask the Simcoe Muskoka District Health Unit this, so I'm going to ask you as well. In your professional opinion, how far away are we from having our first confirmed case here in Parry Sound?
I think it's going to have, well, in Parry Sound, I think that likely you go with population density, similar to Toronto. We felt that probably Toronto was going to be the first case or the area within that, and that's where the cases are. Up north, the first case was in the population more dense area, Sudbury. We've had patients being tested in North Bay, again, larger population, and tested negative. We don't have any positive cases there. Is it going to happen? Yeah. It's more likely to happen up in our North Bay area than it is to happen here at present. And for me to, I can't predict when it will happen here. I think that it's potential that it could happen at any time. But we're not seeing the rise yet up here.
Not to,
so it's hard to predict.
Well, I don't want to make you a forecaster here, and
yes, you are.
I put them on the spot all the time.
Yes, you are.
Environment Canada loves me.
Sure.
I just want to know weeks, days, what potential are we looking at here?
For a positive case here. Honestly, it's hard to predict, and I am being honest with you. I would say the likelihood in North Bay of having a positive case, simply because, and let's look at the evidence, let's look at the facts. What we saw was the case in Sudbury went to that conference. There were a lot of people at that conference. There were a lot of people from up north at the Prospectors Conference, and we know that some of these people are starting to be symptomatic. So far, it's turning out that, they're symptomatic because this time of the year, they're getting cold. There's the flu. We're not done with the flu season yet. So they didn't test positive. And again, it's confusing because people can walk around and have it, and you don't even know it. So I would think that we will, because some of the person in Sudbury went to that conference too, tested positive, that I would think that North Bay would be in front of Parry Sound for that, unless you had more direct contact with people that were down there. I would think in the next couple of weeks that we'd probably see a case up in North Bay. I can't say for sure here as far as that would go, but I would think that you would see it first in North Bay. But we're preparing for it to happen here today, and things are in place. And I think that's a message that we have to get through. Mm-hmm. And it's not fear-mongering. You're not doing that. You're just saying, well, what's the situation? And absolutely great question to figure out. But it really doesn't matter because things are already in place for that.
Okay. Thank you. And thank you very much for all your time today.
Sure, go right ahead.
Most people in the room will know I'm the former editor of the local newspaper. Community journalism brings great value every day. This is the highest purpose when we're in a situation of urgency, and I think all of our organizations are thankful that you're here, and community journalism is absolutely needed. So thank you. A little plug for the work that you're doing. Media relations.
I don't have any money to buy you a train ticket.
Were there any other questions?
Oh, one more. Last one, I promise. Schools are closed. Daycares? The social services agency isn't here, but what are we looking at for daycares for parents? Anyone?
So as a parent, I know that daycares
Yeah, I was just talking to my old daycare provider.
Yeah, so far there hasn't been any release that the daycares are going to be closed. They are preparing to consider having um, smaller sizes and gatherings, but that there hasn't been anything that's been released. So I can't comment on that.
Okay, thank you. I'm really done.
No, that's good. Questions are good. Questions are good. Just to maybe add to what the doctor just was mentioning, you know, the person in Sudbury apparently was at that mining prospector event, that sort of thing, which had a lot of international people there. I think that's something we have to be really cognizant of, is if you're outside of the country and you're in a spot where it is a hot spot, that sort of thing. So those people that are, the message would be, when you come back, make sure you're okay somehow. You know, I mean, whether it's, you know, if you've got some symptoms or whatever, but your symptoms may not show up right away, maybe somebody from the health center or you know, Dr. Scirocco could comment on those people that are coming back from international travel. You know, there are spots within the United States and Europe and that sort of thing or Asia, where there are issues. And if you've been there, what should you do when you come back?
Sure, it's a very good question. Again, I go back to some common sense about this. I think that you have to realize too that what was spoken about and recommendations that occurred when we first found out about this has changed to where we are today. It'll come that international travel becomes less and less important as it is when we find more community spread occurring, because then we know it's in the community, we know it's circulating, and we deal with that. But from people from international travel coming back, I think what the recommendation that we have right now is that you self-monitor. And if you were in a high-risk area, that you have any concerns, then you self-monitor. It doesn't mean that you have to necessarily separate yourself. Once you do, if you do develop symptoms, then it's important then to, again, stay away from the emergency department. Call the public health. Call your primary healthcare provider. Get some advice first, and they don't all need to be tested. So they get some advice, and then you'll get directed as to what you need to do or not need to do. And again, I keep emphasizing, 4 out of 5 people, mild or no symptoms at all, and they may have it. So as we see more and more cases, and we will, because we haven't peaked yet, when we see more and more cases, similar, and I keep going back to the way it's behaving, similar to the flu. We know that every season it comes up like this and usually peaks sometime in January and it comes down like that. And so again, testing becomes more irrelevant. Where you are traveling to or where you go is more irrelevant because you know it's in the community. But it does make you aware that you don't want to be around people that are vulnerable, elderly people, those with compromised immune systems, underlying health conditions. So you keep that in mind. And so a lot of it is that common sense. So it comes down to being informed, being prepared, and being protected.
Anything you want? Nope. Okay. All right. I think, well, we've been an hour at this, which is, I'm going to say really good because there were a lot of good questions. And I really want to thank the Health Center and the Public Health Unit and the municipalities that are here, along with our staff that are working on this, and the media for being here to get the message out. And we also have our representative on public health here, Don Brisbane as well. So I just want to thank everyone for their input into this, because this is a team effort. And thank you for being here today to ask those questions, to give those answers. And I really hope that this gets out to the public so they can at least hear what's going on. Again, it's being live streamed so that people could catch it right now, or it will be on YouTube and on the town's website, and of course being pushed out through local media, through Kojiko, Tom Mango's stuff, the what radio, yeah, that's right, and Moose FM and the Perry Sound North Star as well. So we'll get that information out, and hopefully the public now has a few questions answered, and we move forward in a collective effort to keep this community safe. Thank you.